All right, so we're recording. So hello, viewers. My name is Rashawn. I am a facilitator for a community advisory council that was empowered by the Poudre School District in Fort Collins, Colorado, to offer the school district and school board recommendations about what the Poudre schools should do with the SRO program in the future, because there's been, as many of us know, tons of controversy about policing schools. And so I'm here with a small part of the team of a program called HOOTS, Helping Out Our Teens in Schools, that is based out of the Whitebird Clinic in Eugene, Oregon. And they have a really unique model that they agreed to let me kind of like pepper them, interview them about, and record so that we can have this kind of resource to share about the model in lieu of actually being able to like have these conversations with everyone. So thank you all for being here, Hoots friends. I'll just ask you to introduce yourselves. We'll start with you, Ashley. Just tell us your name, what pronouns you use, I use he, him, and what's your role in the Hoots program?
Sure. My name is Ashley Barnhill Hubbard, and I use she, her pronouns. And I work as the HOOTS program coordinator, and then also as a crisis counselor and medic for HOOTS.
Awesome. Lee, you want to go next?
My name is Lee Galbraith, and I use they, them pronouns. And I am a RN and medic for the HOOTS program.
Awesome. And last but not least, Penny.
My name's Penny. I use she or they pronouns, and I'm a crisis counselor for HOOTS.
Awesome. Well, thank you all very much for joining us. I'm really excited for this conversation. And I just want to ask by starting, and I guess whoever wants to go can start. But the first question is just give us an overview of the HOOTS model. How does HOOTS support schools in the Eugene, Oregon area? Ashley, do you want to?
We do that in a variety of ways. So we started out as a program providing mental health and medical support largely to smaller charter schools in our area. And then we have grown to be in comprehensive high schools as well since then. So our model is always a crisis counselor and a medic, and we have clinics at each individual school. And so those are for a set amount of time on the same day and at the same time each week. They're generally 2 to 4 hours, depending on what we have decided with the school. And we spend that time with as many students as possible. We visit classes, we like build relationship with teachers and school staff, and try and be as helpful as we can. In addition to that, we also do classroom presentations on suicide prevention and like building interpersonal skills for youth in middle and high schools around our county. And then we do tragedy response as well when there's an unexpected death of a school staff or youth in one of our schools.
Yeah, and so while we're there, we just kind of, we work with school staff to get referrals, and we also do our own outreach in schools. So sometimes kids self-refer, and then we talk to the kids that come to talk to us about literally whatever they want to talk about. It could be, I'm stressed out about my homework, or it could be, I want to kill my stepdad.
Yeah. Were you gonna add something, Lee?
Yeah, and just like we are free and confidential, so like kids obviously like we're accessible to them, and we can help them out with getting signed up for things like health insurance as well. So like we kind of reach out and do as many things and have resources for therapists and counselors. Yeah, so we just have like a wider thing.
Gotcha.
Wider depth, yeah.
So let me make sure I'm getting it so far. So you all, HOOTS sends a pair, 2 people in a team, a mental health worker who's well-trained and a medic into schools for kind of like 2 to 4 hour windows, depending on the school. And you all just kind of make these visits across the week, across the school year. And during those times, you're offering some scheduled and some unscheduled mental health and social work support to students and to the teachers and staff?
It's
And medic support, which is less common, but if someone does have, and a lot of schools already have awesome nurses and stuff in them, but if there were to be a medical component, which there often is to what's going on, we can also work with that too.
Gotcha. You were going to add something, Ashley?
Yeah, a lot of what schools do is that throughout the week, they sort of make a list of students that they're hoping that we can check in with. And so it's kind of a combination of scheduled and unscheduled. And then every once in a while, something will come up while we're present at a school. And so we try and do our best to address situations that come up in the moment, and then also be able to spend time with youth that were struggling earlier in the week or are looking for a particular resource and not necessarily in crisis.
Very helpful. So you mentioned crisis. Talk to us about crisis or emergency response. What does HOOTS do and what doesn't HOOTS do when there's an emergency or a crisis that involves mental health or substance use or these types of things?
Yeah, I mean, we're at schools for a really limited amount of time in a given week. And so we're often not there when there is an emergent crisis. When there is, we generally respond to that with school staff, where they will come and get us to assist them with that sort of situation. But a lot of what we are doing is like follow up after something like that has happened earlier in the week, or maybe school staff know that something happened for a youth over the weekend. But yeah, we definitely see a lot of like emergent mental health crises. Some of them like that are chronic as well. And then a lot of substance use, a lot of anxiety, depression, self-harm, suicidal ideation, like the whole gamut.
Yeah.
Yeah, and I would say each emergency situation is really different, and it's really like case dependent. Like we've definitely had lots of times where acutely suicidal youth is at school while they're feeling that way, and then we just work with them and help build a safety plan and help figure out who else are their support people and who needs to get on board, and just help come up with like how we're gonna get through the night, how we're gonna get through the week, stuff like that.
Yeah.
Yeah, and also like making sure that we're coordinating with counselors or other teachers so that there, like Penny said, there is a plan, because we might not be back at that school the next day. So yeah, making sure that there's follow-up with that student the next day.
That's a huge part of what we try and do, is making sure that we're not a safe resource for youth, but then sort of like abandoning them with no one else at the school knowing what's going on with them if they really do need that other support. So we try really hard to identify other adults at school that we can kind of loop in to help support that youth throughout the week.
That's helpful. I want to come back to the relationship with counselors that are in schools kind of more often than you, but I just want to be clear. So like when it comes to a crisis, so if there is active suicidal young person at a school and you aren't already there, can that school call HOOTS and get y'all to rush there, or is what happens instead?
No, I mean, we have the benefit of having CAHOOTS in our community. And so that response is available 24/7. And part of what I think or hope that we do when we go into schools is also build more relationship between schools and that service, and inform youth more clearly and thoroughly, like what that looks like, what accessing that looks like. But yeah, we are not able to respond in that way.
Gotcha. And just for a kind of like explanatory note for the viewers who don't know what CAHOOTS is, that's a separate but related program that Whitebird Clinic in Eugene also runs, that is a kind of alternative emergency response to police and even an ambulance, where there's often mental health or substance use issues kind of that are risen to emergency level but don't require law enforcement. And you also send a mental health clinician and a medic to those situations. Is there anything else that folks should know about the CAHOOTS model, and that's available 24/7 in Eugene. So if there's a crisis at a school, they can call 911 and get that kind of service, which is unfortunately not the case in almost any other place in the United States at this point.
Yeah, but since this is dreaming about a place where people don't have CAHOOTS, like you could decide to build the HOOTS model if this is a direction you chose to go with more hours in schools. We've talked with some school districts about increasing our hours if we can increase our staff. We're pretty small. We're a pretty small program, but we have interest to grow. So I guess I'm just saying like that could, just with some different choices about how long you're in a school, that could be different location specific, you know.
I appreciate you saying that, Penny. And is it, do you think it's fair that you could imagine a HOOTS model also being adapted into like, there is actually a number that a school district could call, and there's like, you know, maybe let's say there's 25 schools, major schools in a school district. And so there's 5 HOOTS teams kind of circulating throughout the district, but that one of them is actually a floater and can be called for an emergency. Would that like make sense?
Yeah, I think, I mean, on the kind of other side of that coin too, like thinking about how staff that already exist at schools, like campus safety monitors has been one of the sort of roles that we have been looking at in our own community of like, how can we empower those folks to be more responsive to crisis, be like in relationship with more students at school, and kind of like take on that role as they're there all the time.
I don't want to make this conversation go too long, but I want you to say just a little bit more, Ashley, about like, how would you make security guards more responsive?
I mean, I think that equipping campus safety monitors with de-escalation tools, with more tools to understand mental health crises and think outside of the law enforcement like frame of reference, I think could go a long ways to having a more of a response that is like always there, that thinks through that sort of like mental health, supportive, trauma-informed lens. And I think also like empowering folks who are already in schools to take on some of these roles a little bit more is really important. Like taking advantage of, yeah, the folks that we have and are already there.
Gotcha. And does Whitebird or HOOTS offer trainings and that type of thing?
Absolutely.
Good to know. Penny, you were gonna say something?
Yeah, just for clarification on what Ashley was talking about, the campus safety monitors are not, this is like something we've been talking about we work with a group who is talking about how to hold the space after SROs, which is basically, it's a lot of different educators from within the district who believe in the project of ending SROs. And so those aren't security guards, actually. They're sort of, I think the vision for campus safety monitors is sort of people in the schools who are down to hold conflict, mediate conflict, and maybe even do restorative justice type work. So I don't know if that's what it sounded like, but I just wanted to clarify that.
I appreciate it, because that's not what I was getting. So I appreciate the clarification and just the dreaming.
I also thought that name was kind of weird.
Yeah. Well, since we're on SROs, my next question is, are there SROs in the schools where HOOTS works, and what does HOOTS's relationship look like with those SROs?
Yeah, we work in schools that both have and do not have SROs. A lot of the smaller schools that we have worked in the longest have never really had SROs, or maybe they have one that is technically assigned to them, but they don't really interact with them at all. But we have pretty limited interaction with SROs. I honestly, like very, very limited interaction.
Yeah, there's one school that we work in that has a SRO who is in the building all the time. He has an office. For many months of last year, he had a wall-sized Blue Lives Matter flag on his wall, which I thought was extremely hostile. And there have been times when we have gone on we have ended up sort of parallel working with students with him. And, we have very different approaches to any situation than SROs do usually. So, oh my gosh, there's a lot of thunder in Eugene.
Oh, wow. I can hear it. Oh, that's great. I love that.
Not like it never happens.
Lee, do you have anything this? I want to just say, can you say a little bit more about people are going to want to understand, in a district where there are both SROs and something like HOOTS, and then a situation comes up, I think folks are going to understand like kind of what's the interaction or the triage or the who does what parts, who doesn't do which, respond to which kinds of calls, that type of thing. Can you just say a little bit more?
The experience that I've had, you're saying if SROs stay in the school and HOOTS are in the school, like how will they work together as a team?
Yes, or what will they not work together?
Or will they not work together as a team? I think my experience, like Penny said, is rare. And I think maybe in my experience of doing it is we had one situation and or the SRO came and just said like, oh, this kid is having a mental health thing, you take care of it. Is kind of the experience that I've had in those situations. Or they come along and they kind of, also what Penny said, like they kind of hover in a way of like creating a little bit of a different atmosphere if it was just us going out there. I haven't had the interaction of like, something going on with something that would involve an SRO, I guess for them is like drugs and alcohol or things like that, or the high things that they're called in there for, or like someone has a weapon or a gun. But I think that's a little bit of the experiences. They're more like, this person's suicidal, you go do it.
Okay, helpful.
Yeah. I'm sure that we just get like we work on different things probably in those schools, and we're not always made aware of what SROs are doing necessarily.
Yeah.
Gotcha. And I'm going to drill down on the SRO stuff because I'm supporting a SRO focused council. So I understand that the HOOTS and CAHOOTS model is designed to address folks with substance use issues. So if there were, a student who came to school high on something, would a HOOTS member be an appropriate person to address that, or would that be an SRO or some other situation?
Yeah, I think we would absolutely be an appropriate folks to help respond to that. I also think we work in a lot of schools that have been responding to that and continue to respond to that really well without law enforcement. And so I don't think that we are necessary. I think that we are a tool and an option in addressing that in a different way. But I think that we have seen a lot of different ways to be able to address that don't involve law enforcement and don't even necessarily involve us.
Yeah, and the CAHOOTS and HOOTS models are both non-punitive when it comes to drug use or drug and alcohol use. Like, I don't know if you want me to speak to that more, but.
No, I think it's been pretty clear, and we can just say that like it is a voluntary program, right? That like you don't have any arresting powers. You're not law enforcement agents, right? So this is so rich, and I like want to go in a bunch of different places that I'm mindful of keeping it short. I want to ask just the short version of the answer. Some people might think, oh, this HOOTS thing, that's an alternative to SROs. Is HOOTS an alternative to SROs? Why or why not?
We are learning about that. Go ahead, Ashley.
I think that we are one small piece of that puzzle. I think that when in us as a program making a statement in support of removing SROs from one of our local school districts, we put a lot of thought and energy in the kind of statement we wanted to make, and the reasons why we supported that decision. And I think that SROs are a relatively new sort of like invention. Like they haven't been in schools for all that long. And one of the, I think, arguments that we have seen come up in a lot of places for SROs is that they are counselors, is that they are supportive for students. But I think that in terms of spending what little money public schools also get, well, like that money goes a lot farther when it can be given to local social services that are able to then provide services in schools. You see more support for students, you see more presentations, you see more support for staff. And so I think that economically, it's a really smart choice, and moving away from having more folks whose role it is to be punitive in schools is also really beneficial when we're talking about our children and how we want to treat them and support them.
Yeah, it's pretty cool to work on HOOTS for that reason, the non-punitive reason, because it's great. It's great to just be a resource in a school that has no skin in the game about whether kids graduate, have no skin in the game about what their grades are, how many credits they have. Like, we're not trying to hold kids accountable for that. So there's like a level to which we can reach them that their school counselors literally are in charge of making sure they graduate and their credits. And so there's always this kind of like dual relationship going on that we don't have to have, which is really nice and helps us in the non-punitive department. And so it's just like we're another support that's valuable and unique in the school. And then the other thing I want to say is that since we made that statement, it's been really cool because it has connected us to so many other educators in the district who really care about making an SRO free environment. And so now through those conversations, we've realized like, yeah, HOOTS is totally part of the answer here, but there's more to do in that way. And there's so many more like individuals in the school who we want to access, who can hold a culture of safety and belonging in schools. And we're just in a lot of cool conversations about that really are like what makes students feel safe and feel like they belong in school, as opposed to creating an atmosphere of like, how do we punish and discipline students for things? And so those projects are moving forward because people are seeing a need for that after SROs. And it's just a really cool reframe on how school culture could be. And you take SROs out and suddenly people want to talk about that. And it is amazing.
It sounds amazing. What's the relationship between, so you all are third-party providers, right? You're like not employees of the district or of law enforcement. And so can you talk about some of the kind of like pros and cons of being a third-party provider, and specifically about what that means about your relationship with the kind of existing counselors or other mental health supports in schools?
Yeah, so I can speak to just like one part or one aspect of like how I said, we're confidential. So like we have different privacy. So we operate under HIPAA and the schools operate under FERPA. So we don't have to like report to a student's parent. Like we have no connection to doing that. So it makes, so that's all, it's a great thing. Like Penny said, we can form rapport differently with students. And we also, it's like tricky and can sometimes be tricky of like how much information we give to a counselor and what we need to give to a counselor in order for them to connect to a parent or to connect to something else. So yeah, that's one way.
And like that whole process has been totally a negotiation in literally almost every school. Some of the schools are just like, hey, whatever, we trust you. But most of them are like, whoa, you're going to talk to kids about stuff and then not tell us what they say. And we have just worked with them and talked with them and built trust. And that has really gone actually surprisingly well. Like they've felt kind of skeptical about it, but they took a risk to trust us. And we have like been accountable to just doing our work well. And we often meet with like in every school we work with right now, we meet with the counselors once a week. And we just check in about each kid, and it's usually them feeding information to us. And we like let them know any basics that they might need to know, like we talked to that kid's mom, or we got them some counseling resources, or stuff like that. Like we share enough information that doesn't break HIPAA for us, that we're collaborating. But they've we've built trust with them, and it's been really awesome to see.
Yeah. Ashley, were you about to say something?
Yeah, I mean, it's a little bit difficult to say what the cons are. I think having not worked for a school, or not having been in that role and knowing how that looks different. One of the big differences, I think, between us and school staff is that we often have the luxury of time. So we don't have an assigned caseload. We don't have a schedule when we're there at a school. We don't have to see a certain number of students while we're there. And so we can spend all of the time that we need with a youth. And I think that is one of the things that really helps shift a situation for a youth, and also like builds relationship with students and with staff. And so that is, I think, huge for us and a huge pro in terms of our service.
Awesome. Thank you for that. Anything else to add on the pros or cons of third-partiness?
I think Penny hit a lot of them, like not being beholden to, sharing information, not being guardian driven.
Mm-hmm. Great, that's good stuff. Super helpful for folks to know. And then the third party part also lends to then like, so there's a contract and like you guys get money. Can you say more about how is HOOTS funded? And talk about the costs for school districts and maybe the savings if you're aware of them.
Sure. So we are funded by either school districts or in some cases individual schools. And we negotiate that on an annual basis, which I think is really helpful in kind of like keeping fresh air in the relationship and making sure that something that, the school still feels is beneficial. We still feel like school staff and administrators are really engaged in having us there and want us there. And it varies. So the schools that are able to afford more, pay more. And then we also work with some smaller schools who are not able to afford quite as much. And so that kind of helps offset things a little bit. Do you want me to say how much money we charge schools? I'm happy to.
Yeah. Yes, please.
So the schools that pay the most, we charge them $110 an hour. So that's for 2 staff people. And then the schools we charge the least, we charge $62.50 an hour. I negotiate these contracts every year. But in that, so for schools that we have those contracts with, that covers not only the clinic time, but also de-escalation trainings for staff, mental wellness presentations for any classrooms, and then tragedy response as well. So there's a lot that kind of comes with that contract. And all of our funding is from individual schools and school districts. Occasionally we get grant funding, which we use to then pay ourselves to do mental wellness presentations in rural areas in our county. We try really hard to never ever charge for tragedy response. And so it's really nice to have grant funding for that. And then for some of the smaller schools where there is financial hardship, when we're able to support them with grant money, we do that.
That's so awesome.
Yeah.
Just like, oh, if only. So Anything else that's, can you say anything, do you know anything about just the hard numbers of like how much, what are the schools you serve not paying for because they have you all instead? Like I'm thinking about savings and just know that that means a lot to administrators.
Yeah, that is, I think would look a little bit different everywhere. So here we don't really have social workers in our high schools. There's just academic counselors who kind of do their best to fill that role of mental health, family support as well when they can. But generally a comprehensive high school with, 1,000 students will have 4 to 6 counselors. So we cost a lot less. We cost a lot less than an academic counselor, than a mental health professional that the district would hire. When the district hires mental health professionals, those folks also are automatically going to be split between many schools. And I think that is a big bonus for our services that schools really want, is that we are never full. We never fill up. We're never not able to see more students. And so it's hard to kind of pin down like exactly what cost saving is. I think that that is one of the huge benefits of schools contracting with social services, is that all of those overhead costs can be like taken on by the social service. And I think that's one of the big spots where school districts get really where costs get really high for them in bringing on new staff.
Yeah. Great. Well, that's helpful. No, I mean, I kind of didn't even know or expect if you would be able to give me a number, but just to think around the savings is helpful.
Yeah.
And then, like I told you all, I just want to get through a set of questions and we can go back to a bunch of other things. But the last question that I have is can you all talk to us about the role that HOOTS plays or doesn't play in emergency preparedness? And along the way, can you tell us what the Salem-Kaiser model is?
What do you mean by emergency preparedness?
Like not natural disasters, right? You're not talking about
Right.
one.
No, I'm not. But I mean, there's schools do, active shooter drills and have plans about, I'm thinking about the ways that schools think about reducing the risk that students might hurt other students, or that, crime prevention, the way that it's kind of looked at. There's a lot of different things that emergency preparedness can mean, but kind of getting ready for the worst. Just are you all involved in any of that stuff? It's okay if the answer is no, but I just know that that's a part of the role that SROs often play, and that's been discussed in our group. So I just wanted to give you all a chance to share about your relationship or lack thereof with that stuff.
We went to the Salem-Kaiser model training and are technically a part of that. And I will let Ashley speak to that because she participates in it more. But
Gotcha.
Yeah, I mean, we have some feelings about it, good and bad.
That's okay. I want to understand what's the model, and if there's not a real connection, that's okay. I just want to get it.
I mean, I think that any sort of proactive support for youth is hugely preventative. That is education and support is the prevention that we are lacking in a lot of ways. These are the sort of as public schools have lost funding over the past, since I was in high school, the removal of programs like the arts, then we saw mental health folks go. And so I think that those are the things that we all know are way more preventative than putting law enforcement in schools. I don't think that there is as much prevention as we want in that. I think it gives folks a sense of safety that to a small extent is real, but to a large extent can be accomplished in much longer term ways in a much larger way. So yes, we are a piece of that. Although it may not really like explicitly seem that way.
Sure. I mean, if if the mental health counseling that a young person gets from a service like HOOTS prevents them from ever getting to such a crisis point that they feel like they need to pick up a gun and come to school, you can't show that on a graph, right?
Yeah. And that's like in the group that Penny has mentioned that we work with, like that group of educators and administrators and advocates that have been working for a long time to remove SROs. That is a huge part of our conversation is like, okay, in removing SROs, what are we working towards? And that is like for our schools to be communities that are supportive of youth and of families, and a place where like all students find community and safety and belonging. And that is how we are preventative. Do you want me to answer the Sam Kaiser question?
I'll see if Penny and Lee have questions or things to add on this other prevention part before we go.
I think also like a portion of what we're doing already is doing the mental health or mental wellness presentations. Like that's kind of like something we're doing to like bring the conversation in. It's like pretty small scale, but can have like a big impact. Like that's how people get to know that we're there. And just like kind of destigmatizing talking about suicidal ideation and like self-harm and depression and anxiety. And so going into like middle schools and high schools and talking about those things, I think is like one step in like prevention of like, hey, we're here to talk about these things and make it, not something that no one talks about. Like, so yeah, I think that's one way.
Yeah, and another thing that's come up in our work group a lot is like, what does strengths-based prevention look like as opposed to emergency response punitive prevention, like that's what the Salem Kaiser model is doing, which seems to have its role, but also how much do we not put resources into strengths-based work, which ultimately is prevention too. And one thing that has really stood out to us this pandemic is we've been lucky enough to know this awesome educator in 4J who he's a Black man who started a group for BIPOC students called EYES many, many, many years ago. And he runs this student group and they talk about like different equity issues and history issues and philosophical issues. And he's been kind enough to invite us to attend. And it's been so amazing because the group that he started before the pandemic has brought kids together twice a week, every single week for the whole entire pandemic. Wow. So it was like in a time of crisis, those strength-based relationships to both kids to each other and kids to this particular person sustained kids through a year of like complete crisis, no school, and everything falling apart. And like also all the school counselors that we work with often like can't get a hold of tons of kids that they, are trying to get a hold of. So it's like, in what way are schools completely turning away from the strength-based stuff and therefore not building any of the relationships with students that could sustain people through crisis? And then we have this awesome example of someone who really put work and effort into that, which isn't that hard. I mean, he just started a student group and was really accountable to it and is an awesome person who kids like to connect to. And that sustained them. And so
there's
huge.
That's a wonderful like example of ways that educators can support people. But what was say more about the strength? We've just said strengths-based support, but what does that mean? Like, what does it look like? Like, what did you do with this educators group that you're talking about? Just so that people can understand what the model looks like.
Yeah, he meets with them twice a week. Me and Lee don't always go. Sometimes we go when we have time. And it's not about us, it's about them. And it's totally like a teenager centered space. And we just have hella deep talks. Like, it's cool. Like, we just go And I'm not using names because like, I don't want to
For
give
sure.
people's work
Yeah.
away, but this person will start it off by like doing some check-ins, kind of like, how are you? What's going on for you? And then there will be kind of like questions posed. And the questions are all just super awesome, interesting things that we all want to talk about. They're about race in America. They're about politics. They're about equity and safety in schools. They're about how have you felt about your teachers? What's going on in your family? What would happen in your family if you decided to marry someone, if you fell in love with someone and decided to marry someone who wasn't the same race as you? Like, we get into these great talks, and it's so cool. And I also remember being a teenager where like all I wanted to do was like philosophically explore the issues of the world. Like my mind was just expanding and I was considering things and I was getting into deep talks with my friends. And there was no adult in my life who were like fostering that or encouraging that. And what if there had been? It could have been really cool and built more trust between me and my school and me and adults in general. So it's not like you have to, this particular form of strength-based work is just really talking to students about the things that they want to talk about and empowering them enough to be like, your opinion matters, your voice matters, like, all of that.
Yeah, it sounds like relationship building. And also, if something comes up, a lot of things about resources that they can access.
And also this person says that he answers their calls whenever they call, and he answers their calls for the rest of their lives.
Yeah, I mean, and that's so much of what good teachers do. But Ashley, I do want to dig in because you had said, we had talked before and you told me a little bit about the strengths-based stuff that I'm glad came back up, because you were talking about there's like presentations you give, and just you gave me this kind of spread of like the groups that you support, like just help people understand what that strengths-based stuff might look like in this kind of like scattershot way. That there's a bunch of ways that it looks, but give us a sense.
Yeah, I mean, so they're like, the group that Penny mentioned is talking about like is a great example, and there are groups not quite like that, but similar to that, that exists.
It said that group sounds like very exceptional.
Yes, truly. But there are other groups that exist within schools that we work at that we try to support or foster relationship with. So there are schools where they have created their own sort of like peer response to crisis within the school. And so we've come in and done de-escalation trainings and kind of like ongoing support for yeah. So they do there's one school in particular I'm thinking of. We've worked with that group for a couple of years now, where so they're doing peer-to-peer crisis support in this really beautiful way, and trying to create like resources that are available within their own school. So they built a clothing closet. They have like food for folks that are food insecure. And they try to make it feel like as comfortable, non-judgmental. You don't need to like tell the entire school, tell administrators. You can just like tell one of these other students and get access to everything you need. So that's a group that we have supported with trainings in kind of like whatever comes up. So that started as de-escalation trainings, and then it's kind of looked a little bit different as they've been supporting students differently during COVID, and as kind of like different issues have come up for different groups of students that have like come up into that student group. So yeah, and then there's funky, like, we're yes people. And so there's a drama teacher that put on a play about suicide, and we went and spoke after the play and debriefed and talked about what resources were available to folks and how to recognize like signs that your friends were struggling. And then we just like, lots of like funky things that folks ask that come up. We've been a part of a lot of like student promotional videos about mental health that have been shown in schools.
That's a great use of your time.
Yeah, we'll get interviewed for like resource projects that students are doing. We'll come into classrooms to talk about all kinds of things, like not outside of the presentations that we do.
Mhm.
There's smaller schools that we worked at, like during when the like different sort of like pop culture, like I don't know, current events things have like come up within a small school. We've like helped support the
Like
response.
hard pop culture things, difficult.
Mhm.
Okay,
Yeah.
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 Which
Yeah.
all is important, like, you know, and I'm sure those options will expand, and especially once schools are back in session, hopefully. But like, it's also, I remember us talking about with our work group, like somebody asking like, okay, you want to solve problems in schools. Like, what are you doing to show that you actually like kids? Like, what are you doing to like, what are you doing to build relationship with them? And so all that stuff does feel really important. And, you know, we've talked about having more like zines and resources for students, just like relationship building stuff that isn't just like, oh, you're having a crisis. Like,
Mm.
like we're here for you. Like, it's more than that.
Yeah, and also like we've also gone to like parents' nights too. So like taking this even beyond students is like we are so open. Like Ashley said, we're yes people. So like people are, you know, parent groups are like, come talk about what you do, and we're like, heck yes.
Mhm.
And so yeah, we've gone to like a psychologist or someone spoke, and we like talked a little bit after that. But yeah, just like reaching out and telling, like widening the community from the kids, and also being like, we're here for, you know, we
Mhm.
exist, and let your kids know, or even like answering questions for parents is also a really cool thing. So
We've had some really beautiful like interventions with school staff too. I think that we forget that like educators have needs and absorb so much crisis and so much trauma from students and families. And we do our best to also show up for them when we can.
Yeah, sometimes
Mhm.
they come in to talk to us about a logistic thing, and then they start crying, and then we're doing hoot stuff.
Yeah. I mean, I think that's a really important part of that I'm glad came up, is that like you all can be present for not just the young people in the building, and that it's really hard to be a teacher, especially these days. And those folks need tons of support too. And I just want to to let the record show, Ashley, you told me an interesting little story about like there are some times where like a student hasn't in normal days, a student hasn't shown up for a minute, and that Hoots actually like might go reach out to that student, and that they then like want to come back to school. You told me.
Yeah, Penny and Lee, I think were responsible for this one in particular. There was one big high school that we started working at, and again, it looks different at every school, and we roll with the ideas that folks come up with. And so during our kind of like downtime when we weren't seeing students at that school, the school staff would give us a list of folks to call that they hadn't heard from or hadn't seen in a couple days, or they thought were really experiencing some mental health crises, and that's like why they weren't attending. And so we would call them during the time we weren't seeing students face to face. And yeah, I think it was you all, right, that had the amazing experience where a student
I don't remember this.
showed up after you all called them.
At Sheldon? I can't remember.
Uh-huh.
I
Yeah.
think that's where it was, Penny. I'm thinking of that experience. Yeah.
It sounds like Penny needs you to like help her finish the story.
Yeah.
It's like it's in there. I just can't remember it.
Yeah. It was a student, and I think somehow either we called them or they called them, and they had come in and they came straight to us. And then to kind of like, yeah. And we I think got like further in creating rapport than a lot of other people did, and like got the student to stay in school. Do you remember now?
Yeah.
You got it. You're on the same page. Great.
Our collective memory.
Yeah, our collective brain is working now.
So help folks tie the thread together. So this student had not been in school for a while. In your off time, the school just gave you a list of people who they were kind of worried about. You gave the student a call, and the student was like, oh, I'm glad you called. I actually wanted to get some support, and like, can I come talk to you? And they came to school, whereas they had not been at school for a while, to come get your services, and then they ended up sticking around at school. Is that the story?
Yeah.
Beautiful.
It was a little coercing had to be done to
Mm.
get the student to talk, or not coercing, I don't like that word, but like there was like a, hey, we really want to talk to you.
You can
But yeah, in so
Yeah,
much
I mean,
as
we
that.
have to build fast rapport with kids,
Yeah.
and then sometimes that is a little harder than others. And I do remember that being sort of like a time when it was hard to build rapport, but then like we did,
Mm-hmm.
and it was cool.
Yeah.
That's awesome. We're already close to the hour mark, and I don't want to keep you all forever. You've been so generous with your time. Is there anything else though that you think folks like really need to know about the HOOTS model?
I have one thing, which is kind of the Whitebird model too, but definitely applies to HOOTS and also really applies to building fast rapport. I just want to speak to like the Whitebird model being kind of like people get hired to do crisis work and counseling work at Whitebird, even when they're not extremely professional people with like lots of degrees. So like Whitebirders will often get hired to do crisis work when their last job was the fact that they were a bartender or a waitress or and I think that's really important because it isn't it means that like a program like HOOTS feels less it's hard for me to know how to exactly say this, but
or professional in the cold way, or
Like clinical.
yeah,
mhm.
like we wear jeans, we wear sweatshirts, we slouch, we bring ourselves to our work and our personalities to our work. We talk to kids about all the stuff that they like to do and make it pretty conversational. And we don't act like an administrator. Like we don't have any of that background, and we don't. And I think that that's really relevant, that Whitebird is building skills into just people from the community. Like it's just building skills into people who live in the neighborhoods that we work in and stuff like that. So
Yeah.
I hope that people take that and use that in their homes to like think about like who you might hire that are just look like people that that the kids in school might see in their neighborhood, or might be their friends or family members or something like that, just to bring a different vibe to a kid's
I'm
life.
super glad you mentioned that, Penny. Yeah, I really appreciate it, because that is something that I think makes Whitebird so unique, is that you all specifically hire for like lived experience, that, you know, people who have had mental health issues in the past or substance use issues in the past are like the folks who you bring on. But there's also training too, and like qualifications that are, so I wonder if someone can just mention, because we should briefly, what are the qualifications that HOOTS workers kind of need to have on the medic side and on the mental health side?
Yeah, we ask that our medics have at least a EMT basic in Oregon, and so that they're ready and qualified to provide that care. And then and aside from that, our EMTs do not need to have any experience having worked as an EMT. And then our counselors, generally we ask that folks have 2 years of direct service experience. So that can look all kinds of ways. Sometimes it's case management, sometimes it's working in shelters. But we have a really, broad range of folks. And our training process is pretty extensive. And so folks are doing Cahoots ride-alongs, and then working in a 3-person team, and then just kind of like learning all the different bits and pieces, and practicing for a while with that extra support before they're on their own.
Yeah, Whitebird does, like, we don't hire people and then just let them free. Like we do long peer.
Yeah, I was gonna ask if you can say more, because that's a part that people are gonna want to know how to replicate. Talk to us about, I guess first, is there some minimum like credential or qualification on the mental health side that folks must have to join the HOOTS team? And if none, and then what's the training like in a little bit more of a granular way?
Ashley, correct me if I'm wrong, but there is not a minimum qualification besides some experience in mental health work or youth work.
Okay.
And the training process is a peer-to-peer training process. That's the meat of it. I mean, there's also like Whitebird offers a basic crisis class, which goes over like tons of different topics involved in crisis work. And there's the HOOTS Academy. So there's like definitely actual training classes that happen, but then mostly it's like a trainee comes, and this is true for HOOTS and the Whitebird crisis team and HOOTS, the trainee comes along on the work for as long as it takes to get them, and like slowly they take over more of the work and lead more of the work until at the end of their training, they're just doing it on their own and you're watching them. And that can take a really long time. Like I think for me on the crisis team, it took 6 months. For me on HOOTS, it took like 4. Yeah, it's a long training process.
The kind of big thing that we look for in folks, like there is that 2 years of experience thing, which can look all kinds of ways for people. But kind of the big thing that we try and impart to new people is that like we are kind of where the buck stops. Like we need to be able to assess like a youth that is suicidal for their safety and come up with that safety plan and feel confident in it. And then on the other hand, like make the call if we don't feel confident at all in that safety plan. Like we are kind of need to be able to assess like, is this situation safe or unsafe? And like be the ones to kind of decide if that emergent help is needed, as in like, is there a large enough safety issue that law enforcement is needed? Is this an emergency to the point where like an emergent medical response is needed? But that kind of like be able to live in that decision-making place where we are responsible to and for those big decisions. Is that helpful?
Yes, it is. And that makes me, I'm so glad. It reminds me of one more question that's important. Can y'all sign mental health holds? Okay, gotcha.
But there's also, Oregon doesn't really do that.
Oh, okay. So it's like yeah.
We have peace officer holds, but that's all
we're kind of like it's very, very difficult to get a mental health hold in Oregon.
As it should be in some ways. But that's, I know, a question that that's like one of the few roles that like schools in PSD aren't doing, and that's an SRO can do that. So I just wondered. But great. I don't want to make this thing go too long. So I will ask just for one more, any last closing thoughts, things that folks need to know, places that people can go find more information.
Well, there's that stuff that are just wanting to throw out there that, oh my God, say something else while I look this up really quick.
There's the Black Organizing Project out of Oakland released a document that kind of looks at how they have removed SROs from their school districts. And then community schools is that model that a lot of folks have been looking at, that we are hoping to work with some of those folks that run community schools up in Portland to be informed as to the direction we're trying to move. So I think those are, good places to start, like looking to districts that have already done this, and schools that provide a lot more than just education to students, families, and communities. Yeah.
Did that give you enough time, Penny?
Well, I was just gonna I can just send you this document, which is the plan. I just didn't want to call this organization the wrong name. So.
Oh, the Black Organizing Project's plan. Okay, great. I would love if you'd send it to me. I was actually just digging on their website, but I meant more information about y'all.
Oh,
People are so, this is like, I've been
That's what
trying
I
so hard
thought-
to make
that's what I thought
Eugene
you
people
meant.
like tell others about themselves, and y'all are just like, I don't know, there's other people who we love too. Like, that's why I love you guys.
Yeah, to find more
that not
out
even
of
occurred
us.
to me.
How do people find out
Well-
more about Whitebird and y'all?
Yeah, you can go to Whitebird Clinic. Is it .org or .net? I don't, .com, I don't.
I think it's .org. This is not, we're failing this question.
We're trying really hard. Here, wait, I have it pulled up. Yeah,
It's .org.
whitebird.clinic.org/hoots to specifically get to us. There you go.
And our email address is hoots, HOOTS @whitebirdclinic.org. So anyone can email that too with more questions or thoughts or musings. We'll read musings.
So we can just send you a haiku or a
Yeah,
thought.
we accept funny memes,
Oh my gosh.
Awesome.
yes.
whatever you got.
Great. Well, thank you all so much. I'm going to stop the recording at this point, but really appreciate you sharing your model and being a resource for folks. So thank you.
Thank you.
Thanks.